All right, we're Justice Through Music, and we're here at the National Cannabis Medicine Unity Conference, sponsored by Americans for Safe Access and many other organizations. And we're here with refugee medical marijuana, medical cannabis refugee, Mimi, and she wants to, Mimi, tell us about your plight as far as cannabis, medical cannabis refugee, and things that people need to know about what medical marijuana patients are going through right now.
Okay, well, I come from Ohio, which is an illegal state, even for medical, and I had to move to Colorado Springs because of the progression of my health conditions. I was in a car accident in 2002 on New Year's Eve, and I was told that I needed to go to pain management therapy, so I started that, and they prescribed 240 pills a month to start. It was 120 painkillers and 120 muscle relaxers for my injuries. And I had a lot of cortisone shots on top of that. I had about 13 cortisone shots. It was 2 sets of 3 epidural injections, epidural steroid injections, and then 2 sets of 3 sacroiliac shots, and a bursitis shot in my hip. I was 19 years old and healthy before my car accident in 2002. I had just gotten out of high school. I graduated in 2001. I had done a vocational program in high school for culinary arts and restaurant management. I was looking forward to a career. I moved to Florida with friends because I liked the climate better than Ohio, and I thought it'd be fun. So I moved out there, and that was where my car accident happened. And I was terrified. I didn't know better than to trust my medical professionals, like I was saying before. They went to school for 10 years.
And the experts.
Right.
And
you're told your whole life that if you get sick, you go to a doctor and they fix you.
And they're almost godlike sometimes, especially the older generation.
Yeah.
You'd think,
Yeah, and that thinking is flawed. Because our doctors are trained to think out of books. Only 13% of our doctors are being trained on the endocannabinoid system.
So you're still going through all your various pills, switching from pill to pill to pill. During all this time, were you smoking marijuana recreationally with your friends?
Not yet.
Did you stop after high school?
I did stop for a while after high school, only because, I thought that I needed to get a good job, and all those things were in my head about all the dangers and all the bad things that aren't true.
So what brought you to medical marijuana? Did a friend come over and get you stoned and all your pain relieved, and you go, whoa?
Yeah, actually, it was a friend. I finally moved back to Ohio, and it was a friend that came over, and I just ended up smoking with them just because I wanted to. But
then came over recreationally?
Yeah, he came over as a recreational friend, and then I found out later that, wait, I can eat and keep food down. Wait a minute, hold on, this actually is helping me. Maybe I should try this again. And through my own experimentation, that's how I came to the conclusion that cannabis will help me and even save my life.
And then, of course, the next day you wanted to go out and get your medicine, some more medicine, and you couldn't because it's illegal.
Yeah, in Ohio you have to buy from street drug dealers, and it's hit or miss, and no one knows what the quality is or what they have or who grew it or where it came from. So it's not like walking into a dispensary where you can say I need a gram of pure indica wax and they'll sell it to you.
So were you sitting there one night watching CNN and they said Colorado made pot legal, and it popped in your mind of maybe I need to move out to a state where there's medical marijuana?
Oh, no. I got into activism. I got into activism in 2010 when I realized that cannabis could help me, and I wanted to get the word out that it could help other people and help people not go through what I went through, which I was still going through it. I was still living in an illegal state. I had to survive off street quality bud, which you have to understand is completely different than dispensary bud or dispensary concentrates. I didn't even know concentrates existed. I had heard something about cannabis oil, but the most talked about was the Rick Simpson oil, and I thought it was just the edible stuff, and I didn't really know about dabs until I moved to Colorado.
So you decided to get into grassroots activism on the state level of your state to enact medical marijuana. Did you contact an organization? How did you go about it?
Yeah, I worked for NORML for years.
Oh, okay.
Yeah, I ran a NORML chapter. I helped Central Ohio, and I helped Cleveland. I was on the board for both for short periods of time. So,
awesome.
Yeah.
And then one day you were thinking, well, why don't I move to a legal state or medical marijuana state? Or did someone suggest it to you? How did that come about?
Not quite yet. I brought up cannabis to my doctors at the Cleveland Clinic immediately when I found out that it worked. And every time they asked me in the emergency room, what medications do you take daily? I would say Prilosec and cannabis. Not giving a crap who I talk to. And that's how you have to be. You have to tell everyone who even draws your blood, say the reason I'm still alive is because of medical cannabis. Do you want to know why? Give them that chance.
What was the doctor's reaction physically and verbally?
Physically and verbally, he was very supportive. He said that he was happy that I found something that worked for me, but that it was illegal in Ohio, so he couldn't recommend it. He couldn't do anything about it. He couldn't prescribe it, obviously, so he didn't even know where I was getting it or anything. It was kind of a don't ask, don't tell thing. So we did that for a while. And I updated him on my progress about the cannabis, but again, I was just smoking flower buds, so they weren't really seeing that great of results with me quite yet.
So in a way, your doctor was working with you for you to go home, find your medicine, dose yourself, and then you report back to him, and he's kind of involved.
Yes. Yeah,
and that's
absolutely.
That's very risky. It's
absolutely.
Not professional.
Yeah, and the Cleveland Clinic staff was very supportive.
I mean, hats off for him to being supportive of you, but he should either help you completely with it, because he's your doctor, right? You shouldn't have to get a little advice and wink, wink, nod, nod. And,
yeah, I shouldn't have to, but medical marijuana use is still very much in the shadows across the country. Even in Colorado, there are doctors that don't want to prescribe it because there's a crackdown going on, and the state is trying to say that medical patients don't ever need more than 6 plants, and you have to prove medical necessity, and your doctors have to jump through a bunch of hoops. So there are going to be less doctors even in Colorado that want to prescribe it. And this is a huge problem across the board. In illegal states, life's impossible. In Colorado, life's possible, but we have problems.
So, like I said, how do you think you arrived at becoming a medical refugee? Explain maybe to the crowd what a medical refugee is and how you decided to do that and where you moved and what happened.
A medical refugee is a person that realizes they're going to die in an illegal state and makes the decision to move to a legal state on their own terms, on their own dime, without help from anyone most of the time. A lot of us don't even have insurance. Fortunately, I had Medicaid by the time I moved, but like I said, I just qualified for that in 2010, and I was sick from, my car accident was in 2002.
You're sitting around with your friends, and you looked over and you said, your friend, I'm thinking of uprooting and taking off to Colorado. And they said, whoa, that's a big move. And, talk to you folks about how, that came about and how it affected you.
Okay. How it came about was after another series of medical stuff that we don't have time to talk about now, but maybe, if anyone has any questions, I'd be happy to answer them later. But after a series of complicated and involved things went on, I had a conversation with my surgeon about what the next step was and what he thought we would have to do. And he said that the only surgical procedure that was an option for me at this point that would do anything to fix my problem was basically open digestive tract reconstruction surgery, where they would have to remove my entire esophagus and pull my stomach up to make a new esophagus and have me live with my feeding tube for the rest of my life. I had a J-tube by this point. And he said that this surgery was absolute last resort. He didn't think it was going to help me because I was diagnosed with gastroparesis too. So he said that pulling the stomach up to make a new esophagus may create the same problem, and if they create the same problem, then I'm ultra screwed because there's nothing they can do. Mm-hmm. So I asked him if moving to a legal cannabis state would be a good idea, and he said, after about a 5-minute disclaimer about how Ohio is still an illegal state and he can't officially make the recommendation for a patient to move, blah, blah, blah. He said, but on your case, we need to think outside the box. And if you found something that's helping you, maybe it would benefit you to live in a place where it's legally available to you.
So your doctor.
My doctor saved my life.
You ran across your doctor and he seemed supportive of it and everything, but obviously, of course, as I know, I'm an Army brat. I've moved a lot in my life. Moving is a big thing, especially for people who aren't an Army brat who move every year like I do. If you move every 10 years, every 5 years, moving is a big thing.
Well, I had to move around a lot when I was sick because I never had an income. I never had a way to support myself. I had to rely on friends taking care of me, and that sucked. It was really bad. It was really hard. And it's so demeaning not being able to have value as a human being, not being able to make your own money and pay your own rent and pay your own bills. That's something that was taken away from me for a long time.
So you felt scared and you took off to Colorado. Did you train or fly there?
No, I actually had a friend drive me to New Mexico initially, and you know, things didn't work out in New Mexico. I actually got admitted to a hospital there because I was still really sick.
Why did you head to New Mexico? Did you have medical marijuana there?
Yes, it was a medical state, and someone had offered to help me there for a little while, so.
So you made a little detour.
Yeah, I made a little detour, and I got admitted to a hospital in New Mexico, and they told me that they thought my feeding tube was infected, and that's the reason that it was hurting so bad, because I got admitted to the hospital for pain and throwing up. And they said the feeding tube had to be removed. And I was freaking out about that because here I am across the country away from the Cleveland Clinic, and my only lifeline is about to get pulled out. And so I agreed to have the feeding tube taken out, really not knowing what was going to happen to me. And then I called my friend actually from the hospital in Colorado, and he said, just take a bus up here, I'll pick you up in Denver, you can stay with me for a little while. And I went up there and I found compassionate people within the Colorado community.
And did it feel great to be able to just, what was it like explaining that you could just,
it was,
you know, of course like, the store has to be open, but almost any time you can get up, go buy some cannabis medicine and come home and not fear of arrest. And explain how that kind of did. Was that a big relief to you?
Yeah, it was a huge relief to me. I found compassionate people in the state to help me, and they helped me a great deal. And
did they help you explain indica, sativa?
Well, yeah, I mean, I already knew the difference between indica sativa, but they educated me on concentrates, which was a huge, huge thing. I switched to concentrates shortly after moving here. And
can you briefly, you know, just a minute or two, you know, explain to the folks what concentrates are? Not many people are educated on that.
Yeah, concentrates are a concentrated form of cannabis that's usually extracted either through butane, which is what I use, BHO, dabs, or there are other extraction methods. And I've been doing dabs. I use pure indica, and I go through about 3 grams a week. But with 3 grams a week of almost pure indica, as close as I can get to it, I find myself really not having symptoms, and really, I still struggle, but I've had some form of a part-time job for the last 6 months. I've been able to improve my credit score by over 100 points just this year. I've been paying my bills on time. I got my life back. I can do all the stuff now that I couldn't do before. I couldn't drive my car before because I was too weak and too dizzy, and now that I smoke, I can. So that's another huge thing. The DUID laws in Colorado are absolutely unscientifically based, and just, they need to go.
So what would you be advised to if someone's on the internet watching this YouTube video right now and they're in an illegal state, no medical marijuana, and you think, I mean, I know you can't tell them what to do to get removed, but you know, you got any advice or anything to tell them?
Yeah,
and also to the public out there, people working in the government, you know, let them know, you know, that we need to get all states with medical marijuana so people don't have to travel.
Sure. Yeah. Don't believe your doctors when they tell you that you're dying and that there's no other option for you. Know that there is another option, and you may have to experiment with it on your own, and you may have to be a criminal, and that's horrible, and I hate that. And I would like for no patient to ever have to be a criminal, because we're not criminals. But the way that the laws are set up right now, you have to just experiment with it on your own. Just take the chance. Your life is worth that chance.